exercise physiology.
Hi, I'm Cheyenne Dunbar, and I'll be talking about occupational
I'm
therapy.
Tamia Paul, I'll be talking about personal trainers.
Hi, I'm Elizabeth Buckholz, and I'll be talking about physical therapists.
Hi, I'm Dakota Skipper, and I'll be talking about physician assistants.
Become a biomechanist includes an undergraduate in exercise science with some physics and engineering classes. Then you go on to grad school and come out a professional biomechanist. A clinical biomechanist studies the mechanism of injury, principles of prevention, evaluation, treatment of musculoskeletal problems. Sports biomechanist examines factors of human movement with exercise and training to improve performance. With a biomechanist degree, you can study ergonomics, which is the study of interaction between humans and equipment. Some places of employment with a biomechanist degree include colleges, private businesses, industrial engineering settings, performance-enhancing centers, sports medicine clinics, and hospitals.
Clinical exercise physiologists must perform health and fitness assessments, design and implement exercise prescriptions, and monitor the effectiveness of interventions. And to do so, they must keep their patients' records on file. Clinical exercise physiologists can receive their undergraduate degree in exercise science with advanced coursework in electrocardiography, pathophysiology, and specific populations dealing with children and elderly. They can receive employment at hospitals, cardiac rehab facilities, outpatient care, wellness, and fitness programs.
As an occupational therapist, your goal is to be able to work with people and help them return to their normal lives, where they are able to perform routine activities inside their home and outside their home, including school and work. The types of injuries that you can see range from long-term to short-term. You can have a patient who has an injury that is to their wrist or their shoulder, or you can have a patient who has an irreversible change, such as the loss of a leg or an arm. The purpose of your treatment for them is so that they are able to continue to do everyday activities like eating, getting dressed, bathing, cooking, driving. Each person within your care will receive a uniquely specialized treatment program designed specifically for their needs. A number of treatment can include range of motion exercises, strengthening exercises, and massages that help decrease pain and swelling. As an occupational therapist, you can work in several different settings. It could be an orthopedic clinic, a clinic that specializes in work injuries, a hospital, or working with children at a school, or in a patient's home in case they can't travel outside of their home. To become an occupational therapist, you first have to obtain a degree. It doesn't matter what type of degree, but a science degree is highly recommended. You will have to complete all the necessary science courses in order to apply for an OT program.
Personal trainers work with individuals to assess functional capacity and develop exercise programs for enhancing physical fitness and health. Personal trainers typically work in the client's home, their personal place of employment, or at a fitness facility. At the fitness facility, personal trainers conduct group exercise sessions such as yoga, Pilates, or aerobics. A personal trainer is recommended to obtain an undergraduate degree in exercise science with courses such as exercise physiology, biomechanics, exercise prescription, and nutrition. Also, gaining a professional certification as a personal trainer or exercise leader from a professional organization such as the ACSM is also recommended.
Physical therapist is a licensed professional that helps develop treatment plans and rehabilitation programs to reduce pain, limit or prevent permanent disability, and improve mobility. They conduct evaluations of muscular fitness, muscle and joint functions, and range of motion. They use information to develop and implement individual treatment programs for patients. Graduates of PT professional education programs must take an exam that is accredited by the Commission on Accreditation in Physical Therapy Education in order to obtain the national license for physical therapy. Some employee settings that physical therapists work at is private practices, medical schools and institutions, hospitals, and other allied healthcare facilities.
Physician assistants are licensed professionals who work under physicians. They work towards prevention, treatment, and rehabilitation of patients who have illnesses and injuries. The average salary that they make in Charlotte, North Carolina is $94,228 a year. Physician assistants primarily work in private practices, long-term care facilities, medical institutions, and other allied health care facilities. All of them can benefit from undergraduate coursework in fitness assessment, exercise physiology, biomechanics, exercise psychology, and nutrition.